Welcome to the fourth and final series of the Creating Wellbeing podcast. In the next 3 episodes of this series, we'll focus on the emotion of anxiety, common causes, symptoms, and effects that anxiety can have on elderly people. In the second episode, we talk about the socio-emotional effects of the COVID-19 pandemic on the elderly in care settings, with specific focus on their anxiety. In the third episode in this series, we look at ways to manage anxiety as experienced by the elderly in care settings using creativity and creative approaches. Firstly, let's look at defining anxiety, specifically as experienced by the elderly. Anxiety is a common mental health condition that affects people of all ages, including the elderly. It can have a profound impact on an individual's quality of life, and it's important to understand what anxiety is, what causes it, what its symptoms are, and how it can affect those who experience it. Anxiety is defined as a feeling of worry, nervousness, or unease about something with an uncertain outcome. It's important to understand that anxiety is a normal part of aging, and it's not something that should be ignored or brushed aside. Many older adults may feel embarrassed or ashamed about feeling anxious, but it's important for them to know that it's not uncommon and that there is help available. It's a normal and often healthy emotion, but when it becomes excessive or chronic, it can interfere with daily activities and have a negative impact on a person's life. This can include simple tasks like getting dressed or leaving the house or care home, to more complex tasks like attending social events. For the elderly, anxiety can arise from many different sources. It could be from health concerns, financial worries, the loss of loved ones, or the fear of being alone and dependent on others. These are all valid and understandable fears, but for the elderly, it can be a new and frightening experience. In addition, the elderly may also experience anxiety as a result of the changes that occur in their social lives as they age. They may be faced with changes in their relationships with their friends and family members, as well as changes in their own physical abilities. These changes can cause feelings of isolation and loneliness, which can contribute to anxiety. Symptoms of anxiety in the elderly can include excessive worry or fear, irritability, restlessness, difficulty sleeping, and physical symptoms like headaches and muscle tension. They may also experience panic attacks, which are sudden and intense episodes of fear or terror that can be accompanied by physical symptoms like rapid heart rate, sweating, and shaking. It can also affect a person's immune system, making them more susceptible to illness and disease. The effects of anxiety in the elderly can be significant. It can affect their overall quality of life and make it difficult for them to engage in activities that they once enjoyed. It can also affect their relationships with others, causing feelings of isolation and loneliness. In some cases, anxiety can also lead to depression, which can further impact a person's quality of life. There are a number of treatments available for anxiety in the elderly. These can include therapy, medication, and lifestyle changes. Therapy can help an individual learn coping strategies to manage their anxiety and improve their overall quality of life. Medication can also be an effective treatment, and in some cases a combination of therapy and medication may be recommended. Lifestyle changes can also be helpful in managing anxiety in the elderly. These can include engaging in physical activity, practicing mindfulness and relaxation techniques, and making changes to one's diet and sleep habits. In addition, staying connected with friends and family members, volunteering, and participating in community events can also help to alleviate feelings of loneliness and isolation. In conclusion, anxiety is a common mental health condition that affects people of all ages, including the elderly. It can be caused by a number of factors, including loss of a loved one, chronic health conditions, and changes in social relationships. Symptoms can be varied, and the effects can be significant. There are effective treatments available for anxiety, including therapy, medication, and lifestyle. In the next episodes, we'll look at socio-emotional effects of the pandemic on elderly people and specific approaches that care workers and others can take to support elderly people reduce their anxiety or alleviate its effects. Thanks for listening.